Hello, and welcome to Assessment Patterns within Pediatric Dysphagia, examining practice trends among speech-language pathologists. I'm Erika Almazan, a PhD student at University of Texas Health Science Center, San Antonio, and this project was completed in collaboration with Dr. Giselle Carnaby and Catherine Crane. Practice patterns within pediatric feeding evaluation by speech-language pathologists are not well known. Additionally, most of our information regarding practice patterns for dysphagia among speech therapists is actually driven by surveys of practitioners who treat adults. Knowing more about current evaluation practices and behaviors among speech pathologists treating children will better help to guide education and resources to these specialty practitioners. We cannot treat the practitioners who see children the same as we treat the practitioners who see adults. These are different patient sets and they require different evaluation. This subgroup analysis of pediatric SLPs or speech pathologists aims to provide direction and characterization in this important and growing area of practice. In order to give us better understanding of what pediatric practitioners are doing when they evaluate a child with feeding or swallowing problems, we analyze survey information regarding practice patterns. This survey data was gathered from a larger parent survey about overall practice patterns among speech pathologists who evaluate patients with dysphagia. We gathered and analyzed the information, which included demographics, clinical assessment of swallowing components, frequency and characteristics of imaging or during the modified barium swallow studies, and the use of both supportive equipment and research-supported approaches within these dysphagia assessments. Our survey was validated and analyzed, and the final survey contained 40 items which demonstrated an acceptable rate of internal consistency. Our survey included responses from 54 pediatric-only practitioners and 31 mixed practitioners, meaning practitioners who treat both children and adults. This survey is, to our knowledge, the largest survey informing on pediatric evaluation patterns to date. Our demographics information can be reviewed in Table 1, and the subgroups of patient etiologies can be found in our Figure 1. The majority of our respondents practice within acute care or university settings, and the majority of the pediatric caseloads consisted of children with developmental delays, prematurity, or respiratory issues. While the overall survey covered a variety of practice patterns within the context of this poster, we cover the use of standardized protocols or procedures and imaging. Imaging refers to modified barium swallow studies in which the speech pathologist uses fluoroscopy, or FEES, in which we use endoscopy. Both forms of imaging identify pathophysiology and help to guide our treatment of patients with dysphagia. Our survey found poor use of standardization by practitioners in both clinical examination and imaging. This poor use of standardization leads to a lack of a minimum data set, which makes it very difficult to compare both between evaluations and between evaluators. Additionally, we found there to be significantly less use of imaging among pediatric-only practitioners, despite high reports of silent aspiration within the literature. This means that pediatric practitioners are not using imaging, even though we know that infants and children are more likely than adults to silently aspirate, meaning we cannot tell if they are aspirating at bedside. We found poor use of standardized or published protocols of procedures in both groups. Additionally, we found reduced use of imaging after treatment, which makes follow-up and summary of progress in therapy difficult. In summary, we found the need for improvement among speech pathologists in the use of standardized assessments at both bedside and within imaging procedures. Education to our speech pathology community on the importance of a minimum data set and the importance of the use of standardized procedures and protocols would help to better guide our pediatric evaluation patterns. Future areas of study include practice patterns among home health practitioners, as we had very few or limited home health respondents to this survey, despite knowing that many children are evaluated in their homes, and perhaps research into why therapists are not using the standardized tools that we have available at this time. Thank you so much for joining me today and enjoy the rest of your conference.